At 2:55 a.m. on November 29th, police were called to this Redmond gas station because of a car parked at a gas pump for 3 hours. When officers approached, they say in the driver's seat they found a 28-year-old woman slumped over with her lethargic and pale 3-month-old son in her lap. According to police, inches away was unpackaged loose narcotics and a pipe on a child's SpongeBob plate. The baby was rushed to the hospital.
The child was found to have tested positive for fentanyl and methamphetamines in his system.
Today, that child's mother was in court to face charges that include endangerment with a controlled substance. Cases involving fentanyl exposure and children are becoming more common, according to King County Senior Deputy Prosecuting Attorney Celia Lee.
The first case that I can think of where fentanyl played a role in a child's death in combination with other factors was in 2019.
Last year, she says there were 3 cases involving toddlers.
Last year was a record year, and we've never had 3 overdose deaths from fentanyl, and we had those last year.
According to the organization Families Against Fentanyl, nationally, fentanyl deaths doubled in the 2 years from 2019 to 2021. But in that same time period, deaths among infants to 1-year-olds quadrupled.
When a child survives exposure to fentanyl, there are only limited charges available to us.
Lee says the felony charge of endangerment with a controlled substance is a law written nearly 2 decades ago that mentions methamphetamine, but not fentanyl.
If it's simply fentanyl and the child survives, what we're limited to is a misdemeanor charge. That law hasn't really caught up to where we are today with the fentanyl crisis.
Lee, along with prosecutors from other jurisdictions, are pushing for a law that includes fentanyl. She says her intention with that is she wants children safe and not in environments where they're exposed to the deadly drug. In Seattle, Natalie Swaby, King 5 News.